I chose orthopedic surgery for many reasons. Had a strong science background, very interested in medicine in general, however, wanted to work with my hands and help people in that way. Orthopedics really blends the two nicely. Hi, I'm James Sieradzki. I'm a board-certified, fellowship-trained orthopedic surgeon specializing in sports medicine and joint replacement. So I've been here at South Bend Orthopedics practicing as a surgeon for the past 15 years. Prior to that, starting in 2009, I finished my training and was working as a resident in orthopedic surgery. I think when people hear about orthopedic or orthopedic surgery, they immediately think surgery and sometimes get scared that, I may not want surgery. And so I think it's important for patients to understand that surgeons like myself are looking at everyone as an individual, trying to understand what their goals and objectives are, trying to understand what treatments would be most appropriate for them, and it's not always surgery. That balance of knowing when to do surgery and when not is helpful in terms of treating a patient. Also, having the experience to know, when it's the right answer for an individual, is quite helpful. So one of my primary, volunteer activities would be as a team physician for the University of Notre Dame. I've been doing that since shortly after I started working here at South Bend Orthopedics. It's definitely been a great honor and privilege to do that, to be associated with such a great university. Certainly something that we value here at South Bend Orthopedics. Probably the most enjoyable part of my job is hearing patients tell me that they're incredibly improved after some intervention that we've had, either improvement in terms of pain level, function, ability to return to the sport of choice or their hobby of choice. Really gets me up every morning thinking, this is what I was called to do.